Oh my god, my Omicron cases, they're through the roof, right? Yeah, sure. Yeah, it's so bad in places like California and New Jersey, they're having to bring in the National Guard to help. Okay, what are they going to do? Fill the places of all of those healthcare workers that you told to fucking hit the bricks because they wouldn't get the poke? Yeah, it's really weird when you have to fucking reconcile those two positions, which you helped enact, Governor Newsom, okay, Phil Murphy. And we're also going to take a look at New York as well because they're just funny in and of themselves. So let's see what they're doing in order to put a band aid on a gunshot wound. Definitely happens in places like New York. The governors of California and New Jersey have activated National Guard troops to assist their COVID-19 response. New Jersey Governor Phil Murphy, a Democrat, said Guard members would be deployed to long-term nursing facilities. Oh my God, to finish the job, you murderous oh no. Such as nursing homes throughout the state because some of them are struggling to maintain adequate staffing. Why is that? Questions. Even though a couple weeks ago at this point, Phil Murphy was out there saying, yeah, we should probably just, end all of this nonsense. But no, just call in the fucking jackboots, you weirdo. Deployment will send members of our National Guard to long-term nursing care long-term facilities, with staffing needs and will act to protect the health and safety of long-term care residents while the Omicron variant surges throughout the nation. Yeah, cool. You're just going to shoot it out of the air? Whatever. In addition, to help test and screen staff, residents, and visitors, the roughly 150 Guard members will help residents with daily activities and setting up meals. Cool. You want to defend the borders of the country. You think that you're doing a good job by signing up for the National Guard, and all of a sudden you're fucking assembling walkers and putting tennis balls on the fucking feet of crutches in order to help people move around? Cool. New Jersey has 513 long-term care facilities with active Coof outbreaks, according to state health officials. 150 Guard members, 513 long-term care facilities. All right, let's see how this works out for you. Governor Gavin Newsom, a Democrat, activated more than 200 National Guardsmen on January 7th to help respond to a surge of cases seen nationwide. Wow, but I thought he was on top of this by issuing so many mandates and vaccine passports. That's not working out for you there, Gav? Sucks to suck. Driven by the dominance of the Omicron variant of the Coof, the number of cases has skyrocketed in the United States in recent weeks. But what about hospitalizations and deaths? Fucking weird thing about that, but how else is California? Okay, because 200 National Guards aren't quite enough. But again, this is a very serious and very important disease to tackle head on, right? And that's why California says COVID positive health workers can get back to work amid the shortages because you got the jab, even though you're positive, because that's how vaccines work. It's interesting, huh? You catch the coof and then you can start going back. Oh, okay, cool. It's such a deadly disease that you don't even know that you have it, but you might have it. And that even if you're sick, even though people are saying, oh my God, if you feel sick, you should just go home because we don't need you here. Unless, of course, you're a nurse because you just continue to turf everybody else out. It's a fucking funny thing about that. California Department of Public Health issued guidance that allows healthcare networks to enable COVID-positive employees to keep working if they don't show any symptoms. The department is providing temporary flexibility. Wow, I wish all of this was still temporary. Actually, they even act like the emergency temporary orders that are in place. Those that you have to, okay, this is such a pressing issue that they have an emergency temporary actions, okay? And now they have temporary provisions for those initial, my mind hurts on this one. Okay, to help hospitals and emergency service providers respond to an unprecedented surge in staffing shortages. Hospitals have to exhaust all other options before resorting to this temporary tool. Oh, okay, cool. I wish that was Gavin Newsom's description. Facilities and providers using this tool should have asymptomatic COVID positive workers interact only with COVID positive patients to the extent possible. Okay, cool. Healthcare workers in the state now don't have to isolate or show a negative test. Okay, the guidance said. Now coming back to work if they are asymptomatic. The guidance, which remains in effect until February 1st, yeah, joke's on you, that's not stopping February 1st, stipulates that staff wear N95 respirators while on the job. Those are just, with the white masks with the yellow bands. And it's like, oh, let's go to a higher higher quality fibers that are in it. Okay, I used to sell that shit. It's still just like your fucking basic bitch cloth masks as well. You remove it, you break the seal, and you futz around with it, and then guess what? It's just not as good as when it was first implied. Okay, so that's just a fucking fact of life. But whatever. Trust the science on this one. Not somebody who has first-hand knowledge of any of it, but whatever. After the guidance was handed down, several unions and that represent nurses and other hospital staff expressed alarm. Of course, because it's California. Healthcare workers and patients need the protection of clear rules guided by strong science, allowing employers to bring back workers who may still be infectious. Okay, cool. You don't even know the CDC guidelines? Okay. 3 days once you're presenting symptoms, and then 2 days after. I'm just saying. Is one of the worst ideas I've heard during this pandemic. Why can't we just make some new doctors? God damn it. And that's really saying something. Bob Schoonover, whatever, head of the union. Of course, it's always these fucking union cronies. Schoonover added that while his union supports supplemental paid sick leave, of course, on your dollar. Where do you think all of this fucking money comes from? President of California's Nurses Association, Sandy Redding, told local media that California Health Department guidance will put patients at risk. Okay, again, if they're positive and they're interacting with other positive patients, what are you anticipating, like super Coof, or what are we doing here? Like, if you got a COVID wing, apparently, I don't know, haven't been to a hospital in a while, thank God, hopefully. We can keep it that way. I'd imagine you have your positive patients somewhere, okay, and then you can have your staff working with them. So what's the problem? I don't know. It's almost like this was just one of those admissions where it's like, yeah, okay, can we just fucking move on from this stuff? But it's not as bad as places like New Jersey, where they just come out and, okay, yeah, listen, okay, we only had so many National Guards workers. Okay, we don't really have all of them that we really need to go to every single long-term care facility, okay, or enough that are needed to help out. And most hospitalized patients with the Coof in New Jersey admitted for non-COVID reasons. Oh, okay, cool. Another one of those really sad admissions like Walensky and Fauci had to make. It's like, yeah, kids are coming in and, oh yeah, they're getting counted as being hospitalized with COVID, but realistically, they're just here with COVID, which, you know what, it's always the sign of a good emergency, life-threatening pandemic when you have to start breaking stuff up with, yeah, people are going to the hospital with, not for, but it's still emergency, it's still troublesome. Cool. Bulk of people hospitalized with COVID in New Jersey were actually admitted for reasons other than COVID-19, officials said Monday. Sucks to suck. Of the 6,075 people with COVID and hospitalized in the state, just 2,963 were admitted for COVID. New Jersey Health Commissioner Judith Persheli said during a briefing. Yep, under half. Just under half. Okay, don't wanna oversell this, but yeah, man, that's really sad now, isn't it? We have a fair number of what I've started to call COVID incidental. Oh, okay, cool. Have it, but not there for the reason. Okay, gunshot wounds. Oh, sorry, you got the Coof. It's like, we need the extra funding. Oh, okay. Or incidental COVID, meaning you weren't in because you broke your leg, but everybody's getting tested. Everybody's running around getting them tests. And it turns out you've got COVID and don't even know it. Very dangerous. My wife didn't know it, and still, she's not back in the game, but never had any symptoms. Weird. So there is a significant amount of that. Once again, very dangerous and a very serious situation. And that's why New York, man, they're trying to be ahead of this. They don't want to activate even more National Guardsmen to help out. They just want their healthcare workers to be as safe as humanly possible by mandating boosters, because everybody could have seen this coming from a mile away, and if you didn't, I'm sorry about your constant mandate of wearing a fucking Jaffa helmet everywhere you go. And no, I won't slow down my talking speed just to help you out understand things better. New York Governor Kathy Hochul said the state will expand its COVID-19 vaccine mandate for healthcare workers to include booster shots, while becoming the first state to require boosters for healthcare employees, while also signaling that the growing number of institutions are increasingly aiming to mandate them. Hochul, a Democrat and an idiot, but I need not be redundant, said in a Friday news briefing that state healthcare workers are required to get extra shots over and over and over again. And if you just heard from Pfizer CEO and Moderna, it really doesn't much matter. Oh, you could need a fourth by the fall. Guess what? We need to start stuffing our coffers because Christmas will be coming around again, which you won't be allowed to celebrate. It's just the people who've been jabbed up 4 times. Yep, it was always going to stop at 2, right? Yeah. Anyways, the state will only accept only medical, not religious exemptions because there is no God. There is only state. Learn to deal with it. You're in New York now. Consistent with previous mandates on COVID-19 and non-COVID vaccines. Under the mandate, healthcare workers will have to get boosters within 2 weeks of their eligibility. Recently, FDA recommended shortening the time. Yeah, I had this article pulled up as well, but now they're telling you, oh, guess what? It's almost like a couple of months ago, Fauci and Biden were talking about boosters every 5 months, and now that's a recommendation. Weird how that shit happens. Center for Disease Control and Prevention signed off on Pfizer's recommendations earlier this week. But, okay, maybe New York's onto something. Maybe they know that boosters and vaccines are safe and effective. Maybe they know something that we don't, okay? And it's not the exact same situation like what's happening in New Jersey. Almost half of New York COVID hospitalizations not due to COVID. Fuck! Thought we had them this time. Didn't. Nearly half of the patients currently in New York hospital with COVID were admitted for other reasons. 43% of the 11,548 hospitalized patients didn't have COVID listed as one of the reasons for admissions. Kathy's office said. Really does suck to suck. What is that? 6,000? No, I'm sorry. That would be what, 5 and change? So yeah, during a press conference, she wanted to drill down on hospitalization numbers to see how many patients were actually being treated for the Coof versus merely having the disease, which is often mild or presents no symptoms, especially with this variant. Some of the patients test positive for COVID, but they're in here for other reasons. Think of all the other reasons people end up at the hospital. It's an overdose, car accident, heart attack, shooting, a robbery gone wrong, a stabbing. This is New York after all. None of that'll be illegal. Thanks, Manhattan District Attorney Alvin Bragg. Hochul announced January 3rd that the state would be separating out hospitalizations from COVID versus those with the disease. Wow, why isn't everybody doing that? And that's very uncomfortable. When is that actually going to get put into place? Because that would be very, very funny. She said that it's important to know the percentage of patients in each category as the number of hospitalizations rise. Yeah, so again, do like the leading causes of death in America. But you won't. Most of the people admitted for non-COVID reasons who have the Coof are in New York City. Wow, a tightly packed area with a transmissible disease. Wow, this is very shocking to me. With approximately half of the hospitalizations there meeting that criteria. Oh, fuck. So still only half. My God. It's such a dangerous, okay? It's such a danger to public health that you need to just constantly put these qualifiers and constantly make these grandiose displays that we're tackling this head on by softening our position on literally everything. But as the government, okay, the government will do whatever the fuck it wants in these Democrat stronghold areas. You get what you vote for, fuckers. But let's take a more myopic view of things, okay? Let's take a look at the entire country. And if you're doing a little bit advanced reading, you're going to spoil yourself on this one. COVID hospitalizations hit record high with 132,646. And again, knowing what we do from New Jersey and New York, you could realistically look at, what, 40% of the people that are there are actually in there for the Coof? Whatever. And cases triple over the past 2 weeks. Oh, but somebody call Sir Mix-a-Lot because there's a big old butt coming. Deaths remain low after CDC Director Rochelle Walensky said 75% of people, get this, 75% of people who die of the virus have at least 4 comorbidities. So these really sick motherfuckers who are actually dropping dead account for 75% of the fucking death total, okay? Why is this still a pandemic? Why is this still being taken so fucking seriously? especially with everything that we know that's going on. It's almost like we're going to have to live with it. It's almost like you can drop the tyranny. We could just go back to life. Yeah, let's read a little bit of this. The United States has reached a new record for number of Americans hospitalized with Coof, with 132,646 currently admitted with the virus. It is yet another marker set during the U.S. record. Omicron-fueled virus surge despite rising hospitalizations, though not as many Americans are dying from the virus as in previous surges. Fuck, we really wanted to run on that one. However, not all of these hospitalizations are directly caused by the virus. No, stop it. You're ruining our narrative. Many people who go to the hospital for reasons outside of COVID, such as injury or other ailments, are being tested while there. Deaths growing at a slower rate, with 1,648 Americans dying from the virus every day, an 11% increase from 2 weeks ago. Oh my God. This signals either the effectiveness of the vaccines, really, or a more mild nature of the new strain. Yeah, I think one we have a lot of documentation, a lot of studies on, and the other one is just, well, a nice marketing line. I'll let you decide. Omicron cases are continuing to rise in the United States, but deaths caused by the virus are not following the same rate. Why? I don't know. It's almost like this virus has been evolving for 3 fucking years. Weird, huh? On Sunday, Rochelle Walensky appeared on Fox News and failed to answer whether or not many deaths currently being attributed to the virus actually have other causes. She told ABC's Good Morning America last week that 75% of people who died from the Omicron variant in the United States have at least 4 comorbidities. Why would she say that to ABC, who wouldn't be receptive to that news, but then shirk her responsibilities of saying that again on Fox News, who would actually eat that up? Weird. Very weird. In what she called encouraging news. Yeah, that's very encouraging news. Sick people die. More 11. What the fuck are you doing? What are we doing? U.S. also surpassed 60 million cases of the virus as of Monday morning, according to Johns Hopkins University. Cool, whatever. The record surge began in December. Albert Bourla, CEO of Pfizer, says the world should be able to control COVID. And by world, he means he, and he alone, and his pals over at Moderna. If you want to, roll the dice, you should just take the Pfizer one. Safe and effective, though. Anyways, and even return to normal in the future, but only if people receive an annual vaccine. No, biannual. Depends on how long this continues to go, because every 5 months, you could eventually get to a point where you'll be getting one in January, in June, and then in November. So, you know what, hey, if you want to go ahead and hop on that fucking carousel of big pharma dependency, you do you. But we'll end on this with a lot of encouraging information, because there's another article that's linked there. It's really close that you could read if you'd like to. Okay, I'll just circle it with my cursor. You can kind of see. You can read that one at your own leisure. I did a little bit of preview through it, and I was going to talk about it here today, but oh boy, is there no chance I'd be able to talk about this on YouTube. Y'all have fun interpreting that one yourself. Anyways, this is really encouraging. T cells from common colds cross-protect against the infection with COVID-19, according to a study. Huh. You're telling me that the common cold, a literal coronavirus, by the way, by proper categorization, by the scientific terminology, is also going to provide some protection against the Coof? Fucking weird. The type of cells produced by the body when fighting common cold virus cross-protect people against infection with the virus that causes the Coof, according to a study published Monday. T cells have been recognized as a measure of protection against severe COVID, and previously research indicated that recovery from common colds may provide some level of shielding against the virus that causes COVID-19. Okay, cool. So literally, so prior infection from the Coof provides you protection, and then recovering from the common cold is also going to provide you some form of protection. Okay, cool. But again, this isn't my claims. These are the claims of actual experts. Researchers with Imperial College London found in a new study that the presence of such cells can also prevent infection from the China virus. Scientists assessed 52 contacts of newly diagnosed COVID-19 cases to the pinpoint when they were first exposed to determine that people who tested negative for the Coof had higher cross-reactive T-cell levels. They also took blood samples from participants within 6 days of exposure. Being exposed to SARS-CoV-2 doesn't always result in an infection. No shit. And we've been keen to understand why. They found that high levels of pre-existing T-cells created in the body when infected with other human coronaviruses like the common cold. Again, don't need to just take whatever I say that just gets backed up again. Can protect against a Coof infection. Ria Kundu, the lead author of the Imperial's National Heart and Lung Institute, said in a statement. Professor Ajit Lavalny, good British chaps, another author, said the study provides the clearest evidence to date that T-cells induced by the common cold coronaviruses play a protective role against SARS-CoV-2 infection, adding that these T-cells provide protection by attacking proteins within the virus rather than the spike protein on the surface. So it goes right after shit, not the binding receptor. They're looking right after the motherfucking core of this shit. So, again, we're figuring out that your immune system is one hell of a weapon to fight this stuff, but don't tell that to Big Pharma, because they just want you on that fucking poke cycle over and over and over again. But unfortunately, we're going to go 3 for 3 today, okay? We're going to talk about the Coof again for the 3rd video, but don't worry, we're going to be a hell of a lot more memey, because one of the most prominent politicians who's 3 times jabbed, she managed to catch a case after she was flouting the restrictions that she wants so bad for everybody else. Not the ones that she wants to live by, but the ones that she wants for everybody else. We talking AOC, and this one's going to be fun as a motherfucker. So if you want an end to the more serious, not like this has been serious, but the more straight-laced, this isn't straight, the more scientific coverage, unfortunately, yeah, it is going to end here today. But if you'd like a laugh, stick around for the next one. It's going to be a hoot. With that said, I thank you all very much for the gift of your time. I've been Don Consuelo. I want you to follow your gut and get after it. Take care, everyone.